Every day, thousands of older adults wake up believing their eyesight is just as healthy as it was yesterday. Then one morning they notice the newspaper looks slightly blurry. The glare from sunlight feels stronger than usual. Driving after sunset becomes uncomfortable. Faces seem a little less sharp. These changes rarely happen overnight. In most cases, cataracts have been developing quietly for years before the first symptom appears. That is why I encourage you to stay with me until the end of this video. The final habit I will share is one that many people overlook, yet it can play an important role in protecting your vision as you grow older. Hello, I'm Dr. Harold Bennett, and I'm delighted to welcome you back. Today, we're going to discuss one of the most common eye conditions affecting adults over the age of 60, cataracts. Whenever I diagnose someone with a cataract, I often hear the same response: "Doctor, I thought this was simply part of getting old." While aging is certainly the biggest risk factor, it is not the entire story. There is far more you can do to support the health of your eyes than most people realize. A cataract develops when the natural lens inside your eye gradually loses its clarity. Instead of allowing light to pass through cleanly, the lens slowly becomes cloudy. As that cloudiness increases, everyday activities become more difficult. Reading small print requires brighter light. Colors lose some of their brightness. Nighttime driving becomes stressful because headlights create glare and halos. Many people assume they only need a stronger pair of glasses, when in reality the lens itself is changing. One of the biggest misconceptions about cataracts is that they only affect very elderly people. In truth, the aging process inside the lens often begins much earlier than most people expect. Small changes can start during your 40s, even though your vision may still appear completely normal. Because these changes happen gradually, many people never notice them until years later, when the cloudiness has become significant enough to interfere with daily life. By the age of 80, most people develop cataracts that have a noticeable effect on their vision. As people are living longer and remaining active well into their later years, cataracts have become one of the leading causes of reduced vision across the world. Here in India, where millions of older adults depend on good eyesight to remain independent, protecting your vision has never been more important. Clear eyesight allows you to read, cook safely, recognize loved ones, enjoy religious activities, travel confidently, and maintain the quality of life you have worked so hard to build. The encouraging news is that science tells us cataract progression is influenced by more than genetics alone. Research involving twins has shown that inherited genes account for only part of the risk, while everyday environmental and lifestyle factors contribute even more. That means the choices you make today, how you protect your eyes, what you eat, and how well you manage your overall health can have a meaningful impact over the years ahead. This is exactly why I decided to make today's video. Rather than filling it with complicated medical terminology, I want to share 5 practical, evidence-based habits that I regularly recommend to my own patients. They are simple, realistic, and suitable for everyday life. More importantly, I will explain why each habit matters, because once you understand what is happening inside your eyes, taking care of them becomes much easier. So, let's begin with the first habit. It is simple, inexpensive, and something many people underestimate, yet it can help reduce one of the most common sources of damage to the natural lens of your eyes. Before we move to the first habit, I'd like to hear from you. If you're still watching because protecting your eyesight truly matters to you, type the number 1 in the comments below. I always enjoy seeing how many people are committed to taking better care of their health after 60. Now, let's begin with one of the simplest ways to protect your eyes every single day. The first habit is to wear sunglasses whenever you spend time outdoors during the day. Many people think sunglasses are only for comfort or to reduce glare, but they do something much more important. A good pair of sunglasses helps protect the natural lens inside your eye from harmful ultraviolet or UV rays. To understand why this matters, imagine the lens of your eye as a perfectly clear window. Its job is to focus light so you can see sharp, detailed images. Over the years, however, that clear window is exposed to sunlight day after day. Ultraviolet radiation gradually damages the proteins inside the lens through a process known as oxidative stress. You do not need to remember the scientific name. The important point is that this damage slowly causes the lens to become cloudy, and that cloudiness is what we call a cataract. Among the different types of ultraviolet light, UVA rays can penetrate deeper into the eye and contribute to long-term damage. Your eyes do have natural defense systems that help fight everyday wear and tear, but they are not designed to handle years of unnecessary UV exposure without support. That is why protecting your eyes before damage builds up is far more effective than trying to reverse it later. The good news is that this is one of the easiest habits to adopt. Whenever you are outside for an extended period, whether you are walking, shopping, gardening, visiting a temple, or simply enjoying time with family, wear sunglasses that block 100% of both UVA and UVB rays. A wide-brimmed hat can provide even more protection by reducing the amount of sunlight reaching your eyes from above and the sides. These small habits take only seconds, yet they may help reduce years of unnecessary stress on your eyes. Now let's move to the second habit, and this one is even more important if you currently smoke or have smoked for many years. Most people already know that smoking harms the lungs and the heart. What many people do not realize is that it also damages the eyes. Cigarette smoke contains thousands of harmful chemicals that increase oxidative stress throughout the body. These unstable molecules attack healthy cells, including the delicate proteins that keep the lens clear. Smoking also lowers the body's natural antioxidant levels. In simple terms, it weakens your body's ability to repair everyday damage. On top of that, toxic heavy metals such as cadmium and lead found in tobacco smoke can gradually accumulate in the lens over time, adding even more stress to the tissues responsible for clear vision. Research has consistently shown that smokers have a higher risk of developing cataracts earlier than people who have never smoked. The longer a person smokes, the greater that risk becomes. The encouraging news is that quitting smoking is beneficial at any age. Although existing lens damage cannot always be reversed, stopping smoking reduces ongoing damage and benefits not only your eyesight but also your heart, brain, blood vessels, and overall health. Many of my older patients tell me they wish they had stopped years earlier. My answer is always the same. The best time to quit was years ago. The second best time is today. Every smoke-free day gives your body another opportunity to protect the healthy tissues you still have. Next, we'll look at another powerful way to defend your eyes from the inside out, and it begins with the food you place on your plate every day. The food you eat every day does much more than fill your stomach. It provides the building blocks your eyes need to repair themselves and defend against the gradual damage that comes with aging. While there is no single food that can completely prevent cataracts, a healthy, balanced diet can help support the natural protective systems inside your eyes and reduce unnecessary oxidative stress over time. As we discussed earlier, one of the main reasons cataracts develop is that the proteins inside the natural lens become damaged. This damage accumulates slowly over many years. Fortunately, many fruits and vegetables are naturally rich in antioxidants, compounds that help your body neutralize harmful free radicals before they can injure healthy cells. This is why I encourage my patients to eat a colorful variety of fresh foods rather than relying on supplements alone. Dark leafy vegetables such as spinach, fenugreek leaves, mustard greens, and broccoli provide important nutrients that support long-term eye health. Brightly colored fruits like oranges, sweet lime, berries, guava, and papaya contain vitamin C and other natural antioxidants. Avocados, tomatoes, carrots, and bell peppers also contribute valuable nutrients that help maintain healthy tissues throughout the body, including the eyes. You may have seen advertisements claiming that certain vitamin tablets or antioxidant supplements can prevent cataracts completely. While these products sound appealing, scientific evidence has not consistently shown that over-the-counter supplements alone can stop cataracts from developing. Some studies have suggested possible benefits, while others found little or no meaningful effect. That is why most eye specialists recommend building your nutrition around wholesome foods first. A balanced diet offers hundreds of beneficial compounds that work together in ways a single pill simply cannot replace. Of course, nutrition is only one piece of the puzzle. Your overall lifestyle matters just as much. Regular physical activity, maintaining a healthy body weight, getting enough sleep, and controlling chronic medical conditions all contribute to healthier aging, including healthier eyes. If you have been finding these practical tips helpful so far, I invite you to subscribe to this channel. Every week, I share evidence-based advice designed specifically for adults over 60, helping you protect your eyesight, maintain your independence, and enjoy a healthier quality of life. My goal is to explain complex medical topics in a way that is simple, practical, and easy to apply every day. Now let's talk about another major factor that many people underestimate: blood sugar. Even if you have never been diagnosed with diabetes, this section deserves your attention. Persistently high blood sugar affects nearly every organ in the body, and your eyes are no exception. When blood glucose remains elevated for long periods, excess sugar begins to damage the delicate structures inside the eye. For the natural lens, high blood sugar creates two major problems. First, excess glucose is converted into a substance called sorbitol. Sorbitol attracts water into the lens, causing its fibers to swell and become damaged. Second, elevated sugar levels increase harmful chemical reactions that speed up the clouding of the lens proteins. Together, these changes can cause cataracts to develop earlier and progress more rapidly. Studies have consistently shown that adults with diabetes are significantly more likely to develop cataracts at a younger age, especially when blood sugar remains poorly controlled for many years. The longer diabetes is present, the greater the risk becomes. Uncontrolled diabetes also increases the likelihood of diabetic retinopathy, another serious eye condition that can threaten vision if left untreated. The encouraging news is that good blood sugar control benefits your entire body. Eating balanced meals, staying physically active, maintaining a healthy weight, taking prescribed medications correctly, and attending regular medical checkups all help reduce the strain on your eyes. These habits not only lower the risk of cataracts but also support your heart, kidneys, brain, and blood vessels. In the next section, we'll discuss one final risk factor that surprises many people because it often comes from medications that are extremely helpful when used correctly, yet they can affect the eyes when taken for long periods. The final habit is one that surprises many people because it has nothing to do with food, exercise, or sunlight. Instead, it involves medications that millions of people use every day. These medicines are often extremely effective and, in many situations, absolutely necessary. However, when they are used for long periods without proper monitoring, they can increase the risk of developing certain types of cataracts. I'm talking about corticosteroids. Steroids are commonly prescribed to reduce inflammation and control a wide range of medical conditions. They may be taken as tablets, used in inhalers for asthma or chronic lung disease, applied as skin creams for eczema or dermatitis, given as injections for painful joints, or used as eye drops after surgery or for certain eye diseases. For many patients, these medicines greatly improve quality of life, and in some cases, they are life-saving. That is why I want to be very clear. Never stop a prescribed steroid medication on your own without speaking to the doctor who is treating you. So why do steroids matter when we are talking about cataracts? Long-term exposure to corticosteroids can increase the likelihood of developing a specific type of cataract known as a posterior subcapsular cataract, often shortened to PSC. Unlike the more common age-related cataracts that gradually affect the center of the lens over many years, PSC cataracts develop at the back of the natural lens, directly in the path of incoming light. Because of their location, even a relatively small PSC cataract can cause significant visual problems. Many people notice increased sensitivity to bright light, troublesome glare while driving at night, difficulty reading, or a rapid decline in the sharpness of their vision. Some patients are surprised by how quickly these symptoms appear compared with other forms of cataracts. Researchers are still studying the exact biological changes involved, but we know that long-term steroid use alters the normal metabolism of the lens cells. Over time, these changes encourage the formation of cloudy deposits that interfere with the passage of light. The longer the exposure and the higher the dose, the greater the potential risk for some individuals. This does not mean that everyone taking steroids will develop cataracts. Many factors influence your personal risk, including your age, overall health, medical history, dosage, and duration of treatment. The important message is not to fear these medications, but to use them wisely and under proper medical supervision. If your doctor has prescribed long-term corticosteroids for arthritis, chronic lung disease, autoimmune disorders, or another ongoing medical condition, ask whether regular eye examinations should be part of your treatment plan. A comprehensive eye examination allows changes in the lens to be detected long before they seriously affect your daily life. Early monitoring also gives your eye specialist the opportunity to identify other age-related eye diseases that often develop silently, including glaucoma and problems affecting the retina. One lesson I have learned after many years of caring for older adults is that protecting vision is rarely about one single decision. It is the result of many small choices repeated consistently over time. Wearing proper UV protection, avoiding smoking, eating a nutritious diet, controlling blood sugar, and using medications responsibly all work together to support healthier eyes as you age. Most people cannot feel a cataract developing. There is no pain, no warning sound, and often no obvious symptoms until vision has already been affected. That is exactly why prevention and regular monitoring are so valuable. By paying attention to these everyday habits, you give yourself the best possible chance of keeping your vision clear and maintaining the independence that comes with seeing the world well. In the final part of this video, I'll bring all 5 habits together, discuss a few additional causes of early cataracts, and explain why regular eye examinations remain one of the most powerful tools for protecting your eyesight after the age of 60. Before we finish, let's bring everything together. Today we've talked about 5 practical habits that can help slow the development of cataracts and protect your eyesight as you grow older. None of these habits is complicated, and none requires expensive equipment or drastic lifestyle changes. Yet, when practiced consistently over many years, they can make a meaningful difference to the long-term health of your eyes. Let's quickly review them. Protect your eyes from unnecessary ultraviolet exposure by wearing quality sunglasses whenever you spend extended time outdoors. If you smoke, make quitting one of the best investments you can make, not only for your lungs and heart but also for your vision. Build your meals around fresh vegetables, fruits, whole foods, and other natural sources of antioxidants instead of relying entirely on supplements. Keep your blood sugar under good control, especially if you have diabetes or prediabetes. And if you need long-term corticosteroid treatment, continue taking it as prescribed while making sure your eyes are examined regularly by an eye specialist. These 5 habits work together because they address different causes of lens damage. Some reduce oxidative stress, others help prevent sugar-related injury to the lens. Still, others reduce unnecessary exposure to factors known to speed up cataract formation. While none of them can guarantee that cataracts will never develop, they can help protect the healthy lens you have today and may slow the changes that naturally occur with aging. There are also a few additional causes of cataracts that are important to remember. A significant injury to the eye can damage the lens and lead to cataract formation much earlier than expected. Previous eye surgery, particularly for certain retinal conditions or glaucoma, may also increase the likelihood of cataracts over time. In some people, cataracts develop because of inherited conditions or other medical disorders that affect the eyes. These situations are not always preventable, but recognizing them early allows treatment to be planned before vision becomes severely affected. One of the biggest mistakes I see is that people wait until their eyesight becomes very poor before scheduling an eye examination. They assume that blurred vision is simply another part of aging or that stronger glasses will solve the problem. Unfortunately, many serious eye conditions including cataracts, glaucoma, diabetic eye disease, and age-related macular degeneration can progress quietly without causing pain. By the time symptoms become obvious, valuable vision may already have been lost. That is why regular comprehensive eye examinations are so important after the age of 60. Even if you feel that your eyesight is reasonably good, an eye examination allows your doctor to detect subtle changes long before they begin interfering with your daily activities. If you have diabetes, high blood pressure, a family history of eye disease, or you are taking long-term steroid medication, these checkups become even more important because your risk of vision problems is higher. I want to leave you with one reassuring thought. Growing older does not automatically mean losing your eyesight. Every healthy choice you make today is an investment in the years ahead. Protecting your vision is not about searching for a miracle cure or a single perfect supplement. It is about making sensible decisions consistently, following medical advice, and giving your eyes the care they deserve throughout your life. Thank you for spending your time with me today. I hope this discussion has helped you better understand cataracts and, more importantly, shown you that there are practical steps you can start taking right away. If you found this video helpful, please give it a like and share it with a friend or family member who is over 60. One simple share could encourage someone you care about to protect their eyesight before vision problems begin. Until next time, take good care of yourself, stay active, and never take your vision for granted, because healthy eyes are one of the greatest gifts for living an independent and fulfilling life.